Hello, this is Jake MD, and I'd like to talk today about becoming a doctor. I find that a lot of people have questions about this, either the process itself because they're interested, or they feel like they have nothing else to talk about with anesthesia person when they're going back to surgery, and I just hear that question a lot. Or it could be people who actually want to become a doctor and then just don't know the exact process of what's going on. So I have a little outline here of how to become a doctor. Let's start with high school. And important thing to do in high school is just do well in your topic and courses overall. There's nothing specific you need to do besides if your school offers a mentorship opportunity like mine did, where you can get some time working in a hospital or shadowing different medical personnel to see if being a doctor is actually what you want to do. And I can't emphasize enough that you want to make sure that you actually want to be a doctor before going down the full road. Like, you don't have to know in high school, but by the end of college, you should definitely know that that's what you want to do and there's nothing else that you want to do instead. Because being a doctor is a hard road, and you lose a lot of your golden 20s, as you'd say, studying, working, and even after that, you work a lot of hours, have a lot of stress, and really your mistakes can mean a lot to people's lives, both short term and long term. So, um, if you're sure that you want to go down this path, that's something that you should just keep in mind. And the best way to do that is to watch people and work with people who are currently physicians or other medical professionals, that you can see what it's really like and not just the glamour you see on TV, which really isn't that accurate to begin with. In college, um, there's not really any hard requirements. You don't have to go to an Ivy League school. You don't have to go to some place that's super well known. And you just need to do well in your courses. And you can pick any major, which is something that a lot of people don't know. You can be a music major and go to medical school after. So it's not hard and fast what you have to do. There are certain prerequisites that everyone has to take, including physics, calc, organic chem, regular chem, and I think a biology course, along with some ethics and some other statistics courses and whatnot. That's not an exhaustive list, but it gives you an idea of the kinds of things that they want you to do. Otherwise, you just have to have good grades in your chosen field. And some schools even prefer non-science majors, just because they are trying to get more well-rounded students that are able to talk to patients and do the other aspects of medicine well. That being said, if you're not good at those topics, don't pick a major because you think it might help you get into medical school. That is a terrible road to follow. And I want to say the same thing with doing mission trips abroad and doing specific research. If you think it's going to strengthen your medical school application and make you a better candidate, well, those things may be true. Don't do something just because you think that someone on a medical school admission committee is going to like it, because that's not a good way to live your life. You can do things because you love to do them, and you can do things because you think that it'll be just good for your career. And sometimes you have to do things that are just good for your career, but I would not do anything too extreme to do that, especially this early in your training. Um, there is a specific test. It's called the MCAT that you take in college to help get you admitted into medical school. And it's a test that everyone takes across the country. It's the same for everybody. And it kind of standardizes the aspects that um, the variability between colleges, we should say. So, since you don't actually know how good a particular college is or how hard it is to get good grades in that college, they have a standard test. That being said, that test is kind of crap, since you have to study specifically for that test. and it doesn't really have anything to do with medicine at all. So it's basically a test to prove that you can learn, and that is about all it tells you. So medical schools like to look at that because it's the equalizing factor between all the different colleges, and it can show some amplitude in learning. But beyond that, it's kind of something you just have to study for. And some people study for a long time. Um, and some people spend a ton of money on coursework for that. There's specific tests and prep courses that you could take. Kaplan is a big name that does those things. Um, are they really worth the money that you spend for it? Probably not. I actually just studied using exam crackers that the library had, and my library is nothing special, and we just had some medical school prep books, and I thought that that prepared me adequately well. As long as you're willing to put in the time, I think that's more important than the actual prep courses. And some people, I'll put in that some people do a master's or research or Peace Corps, years abroad, things like that, in between college and medical school. Sometimes because they didn't get into medical school the first time, sometimes because they want to strengthen their application before they apply. Um, Next, moving on to medical school. It's a 4-year program. 2 years are in the classroom, 2 years are clinical rotations. And I think some medical schools are trying to change that to integrate people into the clinical rotations sooner. But overall, that's generally how things work. Other things on medical school, it doesn't matter that much where you go. If you are accepted at 2 different places and one is like $20,000 a year more for tuition and room and board for that particular area, strongly consider going to the place that's cheaper, because medical student debt is crushing a lot of people in my class right now, and it's something that you live with for a very long time. I mean, doctors make a good salary when they're completely done, but you rack up a ton of interest and debt while that is actually occurring. And a lot of times, the difference between medical schools isn't that big that you're really going to notice a huge difference in your level of training. It's more the effort you put into it and how much you're trying to and willing to learn. Second thing on medical schools, MD versus DO. People make it seem like this is a big deal when you're applying to medical schools, and people think that it's a huge deal to be an MD. And I'll let you know that I cannot tell the difference between my classmates that are MDs and my classmates that are DOs. Some of them are wonderful, some of them have to work harder at things, no matter which program they're in. It doesn't really matter. So if you really want to go to medical school and you can get into a DO program and not an MD program, I do not want anyone to feel like they're letting someone down or they're not a real doctor or anything like that, because I've had some of the best teaching and mentoring of my life from DO physicians, and the only time anyone will ever notice the difference between an MD and a DO is if they look at your name badge and see the two letters, or they look on a paper and see the 2 letters, because they're not going to know any difference based on your training. I think they're both equally good, and it just depends on the kind of person you are more than where you went to school. That being said, medical school is a long and grueling process, and it is a high burnout time in your life, especially the second and third years of medical school, I think. Um, the 4th year medical school is awesome because you're just doing things that you like to do, and the pressure of grades and stuff is gone. And then 1st year is awesome because you're just getting ingrained into the medical establishment and understanding how everything works. And nothing in medical school is difficult. That is something that most people don't understand. Medicine is not hard to understand. The problem is the breadth of information you need to know and the rate that you have to learn it. So I have a stack of paper from my first and second year of medical school that probably goes up to my hip of stuff of just textbooks that I've read fully cover to cover, usually twice. Um, Sometimes more, sometimes just once in certain sections. But the volume of reading that you have to do in medical school is ridiculous, and people equate it to drinking from a fire hose. And that's really true. You spend your entire medical school just reading and trying to learn as much as possible because medicine is such a broad field and it really takes a lot of effort to learn as much as possible. Um, After medical school, you go to residency, and that's where you specialize into whatever kind of doctor you want to be. So that can be anywhere from family practice, which is a 2.5 year program, anesthesia, which I am, is a 4 year program, general surgery is a 5 year program, so is orthopedic surgery is 5 years, and internal medicine is 3. Um, Residency training is very grueling process and really beats you down. It's kind of the hallmark of residency. It's better than it was 10 years ago. Now that they have the mandatory work hour maximums at 80 hours per week or a 30-hour shift, it makes your life quite a bit better. But 80 hours a week, every week, still grinds you down over time. It doesn't matter how upbeat of a person you are, how little sleep you need, it just wears on you. Especially when you're scattering in some overnights and you're scattering in some really challenging cases where you have people and patients die that you felt like you did everything you could, but you get to know someone when you work with them for days to weeks, and it still hurts when those people pass away, and that really hurts morale, especially in the intensive care units or even in the operating rooms. Seeing some of those people and their conditions is really the hardest part about residency training. And since residency is a two-tiered system, there is the intern year, which is your first year after graduation from medical school. And don't confuse an intern with an internist. Internists are actually internal medicine attending physicians. So if someone says, "Oh, I asked the intern," um, take that with a grain of salt because the intern just graduated from medical school, knows basic science really well, but doesn't have the correlation between real practical knowledge in patient care and the basic sciences fused yet. So you don't really want to trust what they're saying hugely. Um, but if it's an internist that says something, especially about infectious disease or medical management of certain conditions, you want to take that very seriously because they are the experts in that field. And like their subspecialty is like infectious disease and endocrinology and whatnot. But I would trust internal medicine doc or an internist with that care over basically any other generalist, including any surgeon or anesthesia person or emergency medicine or whatnot in general, just because that is their bread and butter cases. So that first year after medical school is intern year, and there's places that you do your intern year and your residency training at the same place, and ones where you do it at other places. So there can be some moving around in there, and I'll talk about that in a different video, which is more streamlined to that point. After residency, you'll take your board exams and be certified as an attending physician in your particular specialty. Um, And all along this path, there are multiple tests and stuff you have to take to prove your competencies at that particular field or that particular subspecialty. And after those are all done, you'll be able to get a job working on your own in these particular fields. And as long as you understand that even after residency, you're not going to be knowing the peak of everything that you need to know to do a good job as a physician on your own. It still takes a lot of training after that. And it's all part of that continuing education and making sure that what you're doing is still the best thing to do. So it still involves a lot of reading. So not only is this at best, if you're talking about someone who's going into family practice, which is a 2.5-year residency, and you take only 4 years in college, 4 years in medical school, that's still 10.5 years of training. If you're going into something like neurosurgery, which is a 7-year residency, and usually they do another year or two fellowship after that, you're talking about, and then if you did a PhD in the middle of there, you're talking about almost 20 years of training after high school to become the specialist in that field. So this is a huge road, and the payoff can be good at the end, but man, it is a lot to do. And if you're looking to make money, this is not a good path to go down. There is much easier paths to making money and requires a lot less effort and dedication on your part. You also don't have to work nights, weekends, holidays like you do in medicine, because people are always sick. That doesn't change if it's a holiday, it doesn't change if it's the Super Bowl. You're going to be doing stuff at all hours, all the time, and that's just part of the job. And if you just do clinical medicine in ambulatory settings, then fine, you probably don't have to work as many holidays or weekends, but if you're anyone working on the inpatient side, there's always people in the hospital and there's always people that need your help. So that's something to keep in mind and consider. I think I've rambled on long enough on this topic, so thank you for listening. And if you have any questions, you can either send me a message or comment below. Thanks.